I'm Dr. Jeremy London. I'm a board-certified cardiovascular surgeon, and I've been in clinical practice for the last 25 years. On today's episode, we're going to be talking about heart function, what it is, why it's important, and potential lifestyle changes that you can make to impact it. Now, I've been looking at hearts for over 25 years, whether it's by echocardiogram or an ultrasound or directly in the operating room. And one of the reasons it's so critical is because heart function is the single most important determinant of how people do with heart surgery or cardiac procedures in general. So it's in the forefront of my mind all the time. But today we're going to be talking about a term that you may not be familiar with because it doesn't really make headlines very often, but knowing about it could literally change the course of your health and longevity, and that is ejection fraction. And think about this like a report card for your heart's function and efficiency. And in today's episode, we don't only want to focus on what ejection fraction is, but understand that this could literally be a crystal ball for your future health. And understand that you can actually impact changes that occur with aging by making lifestyle changes. And then we're going to dive deep into the science, looking at Dr. Levine's study, where he showed that you actually can turn back the hands of time with an aging heart, sometimes by almost 20 years. So I think to understand why it is the single most important predictor of longevity as well as outcomes with heart surgery is you need to understand what ejection fraction and what heart function actually means. And let's start from the beginning. The heart itself is a simple closed loop pump that has muscles on both the right and left side to then drive this pump forward. That's ejecting blood with oxygen out of the heart. It goes to the tissues, then is brought back to the right side of the heart, pumped to the lungs, back to the left side of the heart, rinse and repeat over and over and over again. The ejection fraction is the amount or percentage of blood that's actually ejected out of the left ventricle each time it beats or squeezes. Now, interestingly, a normal ejection fraction is 50 to 70%. It's not 100%. It would make sense if you think about it, if you're trying to get as much blood to the body as you can, that you squeeze all the blood out of the ventricle and get it to the tissues. But the reality is the way this pump works is you have to leave a little bit of blood in the chamber so that the filling mechanism will work properly and that the blood supply to the inside lining of the heart is actually intact by some of the blood that remains in the chamber. So a normal ejection fraction is somewhere between 50 and 70%. When we talk about heart failure or a decrease in heart function, what we're referring to is an ejection fraction of approximately 40% or less. Why does this even matter, having a low ejection fraction? Well, think about it this way. A low ejection fraction is directly related to the cardiac output or the amount of blood that's being ejected from the heart. So that is the blood and nutrients that's fueling your entire body. So if that number is decreased 40% or less, that means that there's less blood and nutrients to the brain, liver, kidneys, etc. And a low ejection fraction doesn't just impact how the organs function, it impacts your exercise tolerance, your quality of life, and again, ultimately, your longevity. How impactful is it? Well, an ejection fraction of less than 40% has an increase in the 5-year all-cause mortality to approximately 40 to 50%, and a cardiovascular mortality increase of around 20 to 30%. So again, understand simply that patients with strong hearts do much better than patients with weak hearts. The other thing that I think is important here is that heart failure is super complicated. It's not just one factor, and there's many different ways to measure heart function. But the ejection fraction typically measured by echocardiogram, although there are other ways, is the simplest and probably the most critical factor to measure on the front side. Just so we're all on the same page, an echocardiogram is an ultrasound, similar to what is utilized during pregnancy. A small amount of gel is put on the chest, and an ultrasound probe is then utilized to create images on a screen. And you can evaluate both the right ventricle as well as the left ventricle to estimate ejection fraction. In addition, we get a really good look at all four valves in the heart. It's clear that a decrease in ejection fraction increases all-cause mortality, and secondarily, of course, is going to impact longevity. Well, what's the clinical presentation of a lot of this? It can be abnormal heart rhythms, fluid retention, shortness of breath, decreased exercise capacity, and this can occur as a result of events like a heart attack or severe infection, but it also can result as just a normal consequence of aging, because it's been well shown that as we age, the pumping chambers of the heart, the right and the left ventricle, become stiff. They become less elastic, less compliant. And even without a heart attack, this occurs as we continue to age decade to decade. And this can really sneak up on you. It can happen without even knowing it, even before symptoms occur. And the key here is to identify this early so that you can have the most success with potential interventions. We want to thank the sponsor of today's podcast, Our Place. About 6 months ago, my family and I decided to replace all of our traditional nonstick cookware because we were concerned about toxic PFAS or forever chemicals. These forever chemicals, such as Teflon, have been linked with disruption of our hormone function, reproductive function, gut microbiome, and many other health problems. That's why my family and I do our best to avoid them. That's why we switched to Our Place. Our Place products are completely PFAS-free and toxin-free. We actually chose the Titanium Pro cookware set, which is nearly indestructible, and it can handle temperatures up to 1,000 degrees and looks great. We cook eggs, steak, chicken, bison, and fish on the titanium pans, and it's super easy to clean. If you're ready to start cooking on non-toxic pots and pans, go to FromOurPlace.com/London and use code London at checkout. You'll get a 10% discount on all Our Place products, plus they offer a 100-day risk-free trial. Now you can buy it and try it for 100 days completely risk-free. Again, that's FromOurPlace.com/London, or just click the link below in the description. Now let's get back to the podcast. So what's actually happening as the heart muscle gets stiffer? Well, again, right side and left side of the heart. The right side is the side that fills. It's kind of the holding chamber of blood as it's going to the lungs. Well, this is typically where we see the early signs of this stiffening. So what can happen is when the heart starts to fill, as opposed to being compliant and expandable, it's very stiff. So it limits the amount of blood that can actually get into the heart and consequently get pushed through this closed loop, which is going to, again, of course, affect the amount of cardiac output that you have on the other side. Other side of the heart, the left ventricle, when it becomes stiff and less compliant, it can't pump the blood as effectively from the ventricle. And over time, the left ventricle becomes very thickened as it becomes less compliant. And what that does is it actually makes the chamber in the left ventricle smaller. So the volume that the left ventricle can handle is much less, and consequently the amount of blood that's being injected to the body is limited. What are the major causes of a decrease in ejection fraction or heart failure? The first category is direct damage to the heart muscle itself. The most common one, and one that I think most of us are familiar with, is a heart attack. Well, what happens in a heart attack? The blood supply to a section of the heart muscle is interrupted, and the heart muscle below that area, in many cases of a heart attack, actually dies and turns to scar. Well, think about the scar on your skin in comparison to your normal skin. It's much tougher and doesn't move as easily. The same thing happens with the left ventricle, or potentially the right ventricle, from a significant heart attack. You get this scar formation, you get decreased elasticity. The heart is not nearly as responsive to volume changes as well as creating effective contraction, and you get a drop in ejection fraction. There's other things that can directly damage the heart muscle as well. There are a lot less common infections of the heart muscle from either viruses or direct attack from autoimmune diseases. Something called myocarditis can affect overall heart function. In addition, drug therapies, particularly some very particular chemotherapeutic agents, can directly damage the heart muscle and cause a decrease in ejection fraction. The next category is pressure overload. In other words, the heart seeing increased resistance. One example is high blood pressure. What happens with high blood pressure? Well, the blood vessels in the body are typically in a very clamped down state. They're not resilient, they're not elastic, so every time the heart beats, it's seeing a great deal of resistance. The heart is a muscle. What happens with muscles when they function under tension? They get thicker and thicker. The cavity gets smaller, and this over time is not sustainable, and at a point the heart will begin to fail. High blood pressure is a risk for decreased EF as well as heart failure. Another example of increased resistance is aortic stenosis. The aortic valve sits right at the top of the left ventricle. So every time the left ventricle beats, the aortic valve opens. Well, if there's a blockage there, every time the heart beats, it's beating against a constriction or restriction. And so the same thing happens that occurs with high blood pressure. The ventricle, the left ventricle, gets very thick, the cavity gets very small. This isn't sustainable, and over time, eventually the heart will fail. On the other side of this is the category of volume overload. The heart gets too distended. Well, when does that happen? That occurs instead of having a blocked valve, you have a leaking valve in the heart. So blood is going out of the front door and the back door, and the heart gets very swollen. And the heart muscle does not like to be swollen. And the reason for that is the heart muscle fibers that have to be overlapping to contract get pulled apart, and so contraction gets very inefficient, and the heart gets more and more distended, and again, over time, this will lead to heart failure. The next category is rhythm disturbances. Heart rhythm disturbances, as opposed to the normal heart rhythm where the top chambers beat and the bottom chamber beats in coordination with this. The most common would be atrial fibrillation, where the top chambers are beating essentially out of control. If you look at it in the operating room, it's like a bag of worms moving, and the bottom ventricle really can't get the signal straight. So it's a very discoordinated type of rhythm that results in significant inefficiency. And again, the heart gets swollen over time and can result in a decreased ejection fraction and consequent heart failure. And the final category, and one that we're going to touch on in some more detail in a bit, is lifestyle choices and lifestyle factors. Single one that seems to be most important and most common is a sedentary lifestyle. The next would be poor metabolic health, diabetes, metabolic syndrome, as well as chronic alcohol abuse. We want to take a minute and thank our sponsor of this podcast, LMNT. Hydration isn't just about drinking more water, it's about replacing what you lose. When you sweat from workouts, sauna sessions, or just daily life activities, you're not just losing water, you're losing electrolytes like sodium, potassium, and magnesium. That's why I choose LMNT as my electrolyte replacement of choice. LMNT has everything you need and nothing you don't. Their electrolyte formula uses a science-backed electrolyte ratio of sodium, potassium, and magnesium. Electrolytes are used by every cell in your body, and even minimal dehydration can limit cognitive and physical performance. LMNT tastes great and helps me replenish my electrolytes after a hard workout or sauna. I mix 1 packet of LMNT, usually my favorite flavor, grapefruit salt, in 32 ounces of water to ensure I stay hydrated throughout the day. If you want to try LMNT for yourself, head to drinklmnt.com/London and you will receive a free sample pack of all 8 of their most popular flavors with any purchase. That's drinklmnt.com/London. Plus, they offer an unlimited time, no questions asked refund policy. So if you buy it, try it, and don't like it for any reason, they will refund you. Now let's get back to the podcast. The next natural turn of discussion here, once you know what heart failure is, why it's important, what causes it, of course, is now what can I do about it if we know that this is a normal aging process? The first step, of course, is to start with an evaluation. And that begins most simply with an echocardiogram, as we discussed earlier. It's non-invasive, it's fairly quick, and you get a lot of information. The second would be some labs, depending on your clinical scenario. One would be a BNP, or a brain natriuretic peptide. This is a very general indicator of whether or not you are in heart failure based on blood tests. And it's not used in every clinical scenario, but it can be useful, as can a troponin if you're in an acute setting where they think you might be having a heart attack resulting in decreased heart function. And finally, of course, is an EKG to evaluate your heart rhythm. Once you have this baseline in place, determining whether or not, in fact, you have a low EF, is to look at your lifestyle choices. And that's number one, to make sure you're not living a sedentary lifestyle. You want to create a structured aerobic exercise program. And we'll dive a little deeper into this later when we look at some of the data and some of the study particulars that Dr. Levine performed. In addition, you want to develop a solid, consistent strength training program so that you can maintain or grow muscle, adequate and appropriate weight control, as well as controlling your blood pressure, and a solid whole foods diet. Cornerstones of lifestyle changes to, again, directly affect your ejection fraction. Now, if, of course, you're found to have blockages in your heart arteries, or that there's abnormalities with the valves on echocardiogram, medical intervention may be appropriate. Obviously, if you have blockages, you either want to have a stent placed or bypass surgery to revascularize or reestablish that blood flow to the heart muscle. Valve repair or replacement if you have a blocked or leaking valve, and then rhythm management if your heart is not in a normal sinus rhythm. Medications, where appropriate, I think can have a significant impact. We're not going to go into the different medications for heart failure. That would be about 5 or 6 podcasts just to cover that topic, because it is quite vast. But I think that medications are something, once the lifestyle modifications have been instituted, are an option if you need to go to the next layer. But in the end, I think understand that even though this may feel like an inevitability with aging, there are changes that you can make that offer some hope that you can have an impact here. And we're going to dive deep next into Dr. Levine's study that really looked at how exercise can impact a sedentary lifestyle and have a direct effect on heart function. In 2018, Dr. Ben Levine did a really interesting study where he took 60 individuals, age approximately 50 to 55, that were otherwise healthy, but were leading a fairly sedentary lifestyle. And a sedentary lifestyle was defined in this particular study as exercising 2 times or less per week over a 2-year period. And then he randomized this group of 60 patients into 2 groups. The first group did a slow, gradual ramp up into a very specific aerobic training program that involved 4 to 5 times a week of significant aerobic training, with 1 time during that week being very high intensity training, and then 1 to 2 days were either cross training or active recovery. The other group was randomized to basically yoga type exercises, no formal aerobic type training, stretching, but still had kind of a socialization to feel like they were actually doing something. This was then continued for a 2-year period to maintain a level of consistency, and they had an over 80% adherence in both groups. So the actual involvement of these individuals was significant throughout the study. In addition, they showed by echocardiogram that these individuals had decreased elasticity and stiffening of age-related changes of the heart. And what they found was, at the end of this 2 years, the patients that were in the exercise group had a significant improvement in their VO2 max, or their cardiovascular efficiency overall, of up to 18%, as well as a significant improvement in the elasticity of both the right and left ventricle, basically similar to the heart of 30-year-olds in some cases. So an almost 20-year improvement in heart function in comparison to their actual age. Pretty incredible results, quite frankly. And I think that this data, again, is this glimmer of hope that although we are all on this path to potential inevitable aging of the heart muscle, by avoiding a sedentary lifestyle, we can have a significant impact. Ejection fraction isn't just a number. It's really an indication of how well your heart is functioning to carry you through life. And the data is clear. Even in middle age, you can impact how well your heart is functioning. You can impact how elastic your heart remains. So treat your heart pump like it's the engine of your car. Fuel it properly with a whole foods diet. Keep it running properly with solid lifestyle choices. And take it out for a drive often, because you'll get more miles and better quality miles than you could ever imagine if you do these things. So what's your homework? Well, know your ejection fraction. Get an echocardiogram. Move with purpose. It's never too late to get started. If you've been listening to this podcast up to this point, thank you so much. We certainly appreciate it. If you've been watching on YouTube, you can like and subscribe. If you're listening on Spotify or Apple Podcast, you can leave up to a 5-star rating. We certainly appreciate it. I hope you guys have a great day.